5,970 people are currently hospitalized due to COVID-19 in Pennsylvania as of 7 a.m. this morning. 1,227 of them are in an intensive care unit, and 672 of those patients are on a ventilator. The trend in the 14-day moving average of the number of hospitalized patients per day has increased by 4,900 since the end of September. We do continue to hear of additional hospitals across the state that have very few ICU beds left, or even no ICU beds left. It is very clear that our hospitals and our health systems are significantly challenged in Pennsylvania due to COVID-19. Today, we are reporting 7,962 new cases of COVID-19 and 10,684 new cases from Sunday. This brings our total number of COVID-19 cases in Pennsylvania to 499,764. Of our total cases, the number of people who have recovered from COVID-19 has been decreasing, and that is down now to 58%, meaning that almost half of the new cases have been infected in the last 30 days. 55 new deaths, tragically, have been reported today, and 129 new deaths were reported on Sunday, for a total now of 12,620 deaths in Pennsylvania. In addition, last week, we reported an additional 1,250 new deaths across Pennsylvania from COVID-19. Each of those deaths represents a life lost too soon to this dangerous virus. We also watched the statewide percent positivity, and this was reported on the early warning monitoring dashboard and is now above 16% statewide. Every single county in the Commonwealth now has a percent positivity above the level of 5%. 2 counties, Bedford and Crawford, have percent positivities above 30%. And 15 counties now have a percent positivity above 20%. Throughout the pandemic, there have been now nearly 38,540 cases of COVID-19 among 5 to 18-year-olds. More than 10,500 of those have been recorded in the last 2 weeks alone. Now, last Thursday, the governor and I, joined by 2 healthcare leaders and a virologist, announced our latest mitigation efforts, a pause for Pennsylvania to get us through the holiday season. Our healthcare workers are being stretched to the limit, both in terms of the stress that they are under, but also in terms of working and the number of patients that they are seeing. And we have to work together to protect them from contracting to the virus itself and to ensure that there is adequate staffing at our hospitals. We need all Pennsylvania to look at these mitigation efforts as an opportunity to buy us time. We need to get through what could be a very challenging winter before the vaccines are widely available. Today, however, today is an important day as we look towards the future. Right now, as we speak, UPMC Children's Hospital in Pittsburgh is administering the first doses of vaccine to vital healthcare providers in Pennsylvania. Throughout this week, there are 83 hospitals that will be getting direct shipments of vaccine from Pfizer in 66 counties. Now, I do want to emphasize something I had mentioned before, is that Philadelphia, as one of the major cities of the United States, Philadelphia County is actually receiving its own vaccine allotment. They have their own vaccine plan and have received their own vaccine funding. Now, we collaborate very closely with Commissioner Farley in the Philadelphia Department of Health, but they have their own plan and their own vaccination program. We will be updating you as facilities receive shipments for security purposes. As we start to vaccinate healthcare workers, it will still, however, be months before manufacturers produce enough vaccine to immunize the general public. As we've discussed, there are 3 phases to our vaccine plan, which is now on our website. Obviously, phases 1, 2, and 3. And the general public is in phase 3. And it could be months. It might be spring into summer before we have enough vaccine received from the pharmaceutical companies to immunize the general public. So mitigation now is more important than ever, especially during these winter months. We still need to wear a mask. We need to wash our hands, and we need to social distance. And we have to continue to take these steps until the majority of people in Pennsylvania have been vaccinated. Now, as I mentioned, our updated vaccine plans are available on our website, and they go into significant detail about who will be vaccinated in the first phases of this effort. Now, I've said for months, there are 3 ways to deal with a pandemic. The first is through containment, through significant increases in testing, case investigations, and contact tracing. It's very challenging now with our high case counts, and we have to prioritize congregate settings such as long-term care facilities, corrections, schools, as well as vulnerable populations such as seniors. The second way that we address the pandemic is through mitigation, and that includes our pause in Pennsylvania, our Pennsylvania in pause, as we work to get through the holiday season. And the third is through medical countermeasures. Now that includes new treatments, such as the new therapeutics and the monoclonal antibody infusions, but primarily this includes the vaccines. And they are being administered in Pennsylvania as we speak. We know that this has been a challenging period for Pennsylvanians, for everyone in Pennsylvania, but today is a new chapter in this fight. And so in the meantime, until we can get everybody vaccinated, we need people to stand together, to stand united in Pennsylvania to stop the spread of this virus. We need people to answer the call and to wear a mask. We need people to answer the call and to wash their hands and to social distance. We need people to answer the call and avoid small and large gatherings and to stay home. We need people to answer the call and download the COVID Alert PA app. And we need people to literally answer the call if you get a call from one of our case investigators or contact tracers. And as I always like to close, please stay calm, stay alert, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. Our first question is Jamie Martinez, the Spotlight PA. Jamie, go ahead and unmute yourself.
Hi, Secretary Levine. Thanks for taking questions today. I'm hoping you can talk a little bit about what's happening in the Keystone region. It looks like hospital admissions for COVID admissions, went up significantly, more than 200%, and they're teetering on the edge of staffing issues as well. Is anything going to happen with state intervention there? If you could just talk a little bit about what's happening in the region and what the state is going to do to respond.
Sure. Well, we are seeing significant increases in the number of patients with COVID-19 admitted to the hospital throughout the state. And that includes the patients admitted to intensive care units. And the Keystone region has been challenged on and off for weeks now. And so that is why we have our dashboard, so that we're able to watch it, and we get, of course, very daily granular data, and we're able to depict that for the media and the public. And so, we will work with the hospitals in the Keystone region through our healthcare collaboratives. And each of those regions have a healthcare collaborative, and we need them to coordinate and to collaborate together in terms of their admissions. We need them to work to postpone truly elective procedures. There are some procedures, of course, which have to happen for urgent and acute issues. But if there are procedures that can wait, we need them to postpone them. We need them to make sure that they share staff, that they share resources, and collaborate together to be able to take care of the significant number of COVID-19 patients as well as non-COVID-19 patients. If the metrics gets triggered, then they will have to decrease their electives 50% for 1 week while we work with them to accomplish that.
And if I could just follow up, have you been able, or has the department been able to identify why there's been such a significant surge? I mean, close to 300% in admissions is a lot. So is there that's causing more of a spread?
It's because we're seeing significant levels of community transmission in that Keystone region. So if you look at the number of cases in the counties in that region, it's going up, and of course, as the number of cases go up, usually within 1-2 weeks or more, certain patients get sick enough to require hospitalization. There's nothing else going on.
Thank you, Secretary. Next up is Jen Rahill. Jen, go ahead and unmute yourself.
Thank you, Secretary. A question about vaccines. Do we have a number? Do you have a number yet of how many Pfizer vaccines Pennsylvania is going to be getting? And, I'm wondering if you could drill down a little bit more into how it will be given out, or how they'll be given out when they get here, and if there are certain regions that are a priority. For us, we're in the Lehigh Valley, but also just wondering more statewide as well.
Sure. So the report that we have had is that we'll be getting 97,500 doses this week of the Pfizer vaccine. It comes in trays of 975 doses. So that's kind of how those distributions work. Again, remember, the Pfizer vaccine is the ultra cold chain vaccine. And this week they're going to be going to 83 hospitals throughout the state. And these are hospitals that have the ability to refrigerate the product and have the ultra cold chain, and the ability to give almost 1,000 vaccines after in a pretty short period of time after they receive the product. Next week we're going to be getting more Pfizer vaccine, and they give us an estimate of what that is, but really as it gets much closer to the time is when we find out exactly how much we're going to get. And then also we're anticipating next week, if the FDA and the CDC approve the Moderna vaccine, we'll also be getting shipments of the Moderna vaccine next week. Of course, it's too early to know exactly how much we're going to be getting.
If I could ask as a follow-up, in a year that has been full of terrible, terrible news, how does it feel to be getting vaccines and being able to roll that out? What's that like?
It's tremendously exciting, and our whole team has been working on this project for months and months and months, and working with all of our healthcare partners and Operation Warp Speed and the CDC. So it's tremendously satisfying to be able to get the vaccine and to start immunizing. But we have to be realistic as well. It is going to take significant period of time to roll out the vaccine through the 3 phases and to immunize the public in Pennsylvania, as it is throughout the country.
Next up is Flora Posterer with PennWatch. Flora, go ahead.
Good morning, Secretary. My apologies. I had a hard time hearing how you answered the beginning of the last question. How many doses, in fact, are we getting?
We're going to be getting 97,500 doses of vaccine this week. It comes in trays of 975 doses, and so we'll be getting 100 trays. And so that's going to be going to 83 hospitals throughout Pennsylvania that have the ability for the ultra cold chain and to be able to immunize significant numbers of people, of their healthcare personnel, in a pretty efficient way.
Obviously, this vaccine was pushed through very quickly. How would you convince someone to get this vaccine when we really don't have a long clinical trial? It was only 60 days. What would you say to someone who isn't really comfortable getting the vaccine?
Sure. So I would disagree that this vaccine was quote unquote, pushed through quickly. I mean, the pharmaceutical companies have been working on this new technology of messenger RNA or genetic material vaccines for years and years. And what was done is the pharmaceutical companies received billions of dollars from the federal government to be able to all develop the vaccine at the same time. That's not how it usually works. But that is the heart of the development process of Operation Warp Speed. they have gone through the same full initial clinical trials that any vaccine would go through. And so, I think that that with the FDA review and the CDC review, that these vaccines are safe and they are effective. And I would really encourage people to strongly consider when the time is right, depending upon what phase they're in, to really get the vaccine and to protect themselves, their families, and the community against COVID-19. I feel very comfortable that this vaccine, and then after the approval process for Moderna, that vaccine is safe and effective and ready to immunize the public.
Next up is Maggie Kent from WPVI. Go ahead, Maggie.
Thank you, Dr. Levine. My question is in terms of a larger scale rollout. We know that the hospitals will be administering vaccines this week and for the weeks to come, as all of the healthcare workers need to be immunized. But I also know that there was some talk about including the National Guard and things like that. How do you see that being incorporated when we get more of a large scale process in place?
Sure. So as I mentioned before, there are 3 phases, and this phase 1A and this phase 1B, and this is all outlined on the plan in the website. So the CDC and the Immunization Committee of the CDC has determined that phase 1A are healthcare workers and are going to be vulnerable seniors in nursing homes and other long-term care facilities. And so later in December, that mission will start as well. And so that is the initial rollout of the vaccine, which is considerable. I mean, we have thousands and tens of thousands of healthcare workers, and obviously, many vulnerable seniors and staff at these long-term care facilities. Phase 1B are frontline workers, and that would include the National Guard. I can't tell you exactly when that will occur because, we don't exactly know until very close to the week where it's going to be distributed exactly how much we're going to get. So, that is talking weeks and weeks from now. So first up, as determined by the federal government and the CDC, are the healthcare workers and the seniors in long-term care facilities. And then we'll be moving on to frontline workers in phase 1B.
Okay, thank you.
Sure.
Next up is Jim Melward from KYW. Go ahead, Jim.
Hi, I have a question, but really quick follow-up on Jen's question. Do you have an idea of an allotment for regions of the state at this time?
Well, so again, it's going to be going to many hospitals that have the ability throughout the state that have the ability to be able to do the ultra cold chain, and will be able to immunize a significant number of people very, very efficiently. So those hospitals are throughout the state. Which hospitals get vaccine each week depends upon how much and how many hospitals depends upon how much we get. So we know this week's, and we will be reporting after the hospitals receive their allotment. We will be reporting that they have received it. I can't tell you about next week's because we don't precisely know what next week's allotment will be. The rollout to nursing homes and long-term care facilities is through a federal partnership with Walgreens and CVS pharmacy companies. And those companies will be doing the rollout to the nursing homes and other long-term care facilities.
And you've mentioned in the past the challenges with federal funding or lack thereof. Do you have any update on that? Is there any kind of idea of what you have and what's needed?
Well, we know how much money we're going to be getting. I mean, there was $340 million allotted in 2020 to the entire country. So that includes all the states, the territories, and the big cities that are accomplishing this mission. Pennsylvania's allotment was somewhere around $14.6 million. So in Pennsylvania and throughout the country, that's a little bit over $1 per person. And that's insufficient to complete this mission. It's enough to get us started, although we absolutely need more money to do the communication and education that we want to do about that vaccine, much more than just these press conferences. And we're looking for other funding to do that. So last week I testified before the Senate as the president of ASTO, the Association of State and Territorial Health Officials, and highlighted that we need more funding to be able to complete this mission. And I know the governor was speaking with the governor of New Jersey, I believe, about that today as well. It is absolutely clear that the states, territories, and cities need more funding to complete this mission over the long term, over 3 months, 6 months, 9 months or more. And, we will stand hopeful that that money will be forthcoming.
Next up is Sam Rulin from the York Daily Record. Go ahead, Sam.
Hi, my question is just kind of looking for some clarity real quick with something. I understand that Walgreens is going to be helping out with administering the vaccinations getting to nursing homes. We had been hearing some nursing homes at least reporting or telling some other reporters in our network that they were getting their shipments this week. So is that accurate or not? Just because I know that Walgreens is doing that. I wasn't sure if that was included in this week or not, or if it was just hospitals right now.
So the information we have from the federal government is this week is hospitals, and that the mission for the long-term care facilities through Walgreens and CVS will start within a couple weeks.
Okay, great. Thank you very much.
Okay, next up is, give me 1 second, please. Jamie Bittner from Fox 43. Jamie, go ahead and unmute yourself.
Hi, Dr. Levine. I had a twofold question for you. Number one, when the vaccine arrives to essential workers, is there any industries in particular that you're targeting first, such as the food industry? And number two, my question is, by the time it rolls out to the general public, I would assume people are going to have a choice on what vaccine they want to get, whether the Moderna vaccine, the Pfizer vaccine, or any others that are approved within that time frame. My question is, will they have a choice, or will they have to accept whatever vaccine's available?
Well, so we will see as we get to phases 2 and general public is phase 3. There might be more than 2 vaccines available. So we are hopeful about the AstraZeneca vaccine and the Johnson & Johnson vaccine. They're either finishing or getting close to finish their clinical trials. And then there are even 2 more vaccines in the pipeline, although they haven't started their clinical trials. So, I think that different sites will have different vaccines. People will have a choice which site they go to. For example, we in phase 2 and 3, we plan to use pharmacy partners, many pharmacy partners, I believe 19 or more pharmacy partners in Pennsylvania. We'll be working with federally qualified health centers. We'll have vaccine clinics, et cetera. And so different places might have different vaccine depending upon the rollout. So I would doubt that a single place would have 3 vaccines all in a menu that people can choose from, but different sites would have different vaccines. But we're not there yet. We're just starting today with our first vaccinations for healthcare workers. Did you have another question?
Yeah, my other question was, when it rolls out to essential workers, is there certain industries that are considered more essential than others to get this vaccine, such as the food industry?
So all of that is on our website in the plan. But for example, we would certainly be including the law enforcement. We're including the fire departments, the National Guard, and then there's lists of who's included in 1B on our website.
Next up is Sarah Bowden from WESA. Go ahead, Sarah.
Hi, good morning, Secretary. So Pennsylvania this week has received some 97,000 doses of vaccine. Are hospitals being told to reserve half of that because the vaccine is a 2-dose regimen?
No, actually, Operation Warp Speed is reserving. So for every dose they send us, they are putting in their storage the same number of doses, so that for the Pfizer vaccine on 3 weeks later, so on week 4, that they'll be shipping that out, and all those people can get a second vaccine. When the Moderna vaccines, they'll be doing the same. So we don't have to store, the hospitals don't have to store it. Operation Warp Speed is storing it for us for the next rollout.
Okay, great. And then when will you and the governor and your staffs get vaccinated?
So we haven't actually made a decision about that. So I'm sure I'll be discussing that with the governor and the staff, later this week.
Next up is Bill O'Boyle from the Wilkesboro Times Leader. Go ahead, Bill. Bill, go ahead and unmute yourself. Okay, we need to move on. We'll go to Tim from One United Lancaster. Tim, go ahead and unmute yourself. Okay, Tim is passing.
To Bill Keibler, I believe.
Okay, thank you so much. Next up is Bill Kibler. Bill, go ahead and unmute yourself.
Can you hear me?
Yes, we've got you, Bill.
Yes.
Oh, thank you. Can you talk a little bit about the difficulties of maintaining a temperature of what I understand is minus 94 Fahrenheit, and how long the vaccine can be out of that temperature safely?
So that is why we are shipping only to hospitals that have the refrigeration capacity to keep it at that temperature. And then when they break open the cases, they can remove it, do the immunizations, and that is informing the choices in terms of hospitals. There's a specific period of time that they can be out of that temperature. I actually don't have that at my fingertips, but I'm sure that that's easily available, from Operation Warp Speed, exactly how many hours it can be kept, for instance, at room temperature. But you're going to have to immunize a lot of people pretty quickly, and so that's informing the hospitals that have been chosen to be able to take the product.
Thank you.
Sure.
Next up is Erin McCarthy. Erin, you'll get a message to unmute here in just 1 second. And go ahead.
Thank you, Doctor, for taking the time to chat with us today and answer our questions. Mine is about the mitigation measures that were announced last week. In the Philadelphia region, and I imagine elsewhere throughout the state, there are several gyms, bars, restaurants that are either openly or covertly defying your order. I know the Commonwealth has said that owners could be cited and liquor licenses could be suspended. Given how bad cases are right now, do you plan to take any stronger action this time around against establishments defying your order? And if so, what do you plan to do?
Well, I know that that the Department of Agriculture, as well as the officers that work with the Liquor Control Board, have been out, and they have been doing citations and investigating bars and restaurants, et cetera, that have been open. And I'm sure that will go through the same legal process that it was going through before. There are no plans to do anything different than what we have been doing all along.
Okay, and last up is Jim from WTAE. Jim, go ahead and unmute yourself.
Thank you, Dr. Levine. Looking at some of the mitigation factors as well, we had a question on that. New York had a press conference last week with Governor Cuomo where he changed some of his mitigation tactics and referenced how gyms accounted for a very small percentage of the cases they're seeing out there, and he allowed gyms to open back up. When you looked at the numbers here, what was it specifically about gyms that stood out to you to include them in this tactic, and what do those numbers show on your dashboard here?
So we have seen all along that gyms can be a vector and a source of transmission of the virus. So it's very hard to have specific granular detail in our recent containment. Because it is really hard when you have 11,000 people to be able, new patients per day, to be able to reach them. And so we are prioritizing, as I mentioned, in terms of our case investigations and contact tracing, we're prioritizing congregate care settings such as nursing homes and other long-term care facilities, schools. We're prioritizing, clusters, et cetera. So I'm not going to have recent mitigation data, but we have that from before about the data associated with gyms, and there have been published studies about the data associated with gyms. So we would respectfully disagree with New York, and so we feel that the gyms for the next 3 weeks, and now is even less than 3 weeks, should be closed.
Jim would like to ask a follow-up. Go ahead, Jim.
And that last question before this about bars and restaurants that have openly said that they're planning to defy this order. You mentioned kind of the enforcement tactics, but in general, what would be your message to them, especially those that have expressed some frustration that they're being targeted by these efforts?
Well, I mean, they're not being targeted in any way by the governor or myself. Unfortunately, it has been very clearly shown in the literature for months and months now how restaurants and bars can serve as an area of significant spread of COVID-19. You cannot physically eat or drink with a mask on, so you're by definition going to have your masks are off. And depending upon the ventilation system, et cetera, it is very easy to spread. And there was even some recent articles, both in the United States and internationally, about that, even in the last number of weeks. So we're not trying to target that industry. What we're trying to do is to stop the spread of COVID-19. And to do that, we need people to stand united with us and to join with us in terms of these mitigation efforts. We need people to wear masks if they are outside of their home, or if they have people in their home outside their household, to wear a mask as well. We need people to wash their hands and use hand sanitizer. We need people to avoid large gatherings, but to avoid small gatherings as well. We need people to avoid even bringing their neighbors, their family who don't live with them into their homes for the holidays, which is a tremendous sacrifice. But that's what we need to do right now. And we need people to not go to to frequent those restaurants and to frequent those bars because they're not contributing to the global effort to stop and the Pennsylvania effort to stop the spread. This virus has shown us, like nothing else, how interconnected we all are. We're all in this together. There is a light at the end of the tunnel. Today is just a great day where we start immunizing people, just to start, but we start immunizing people right here in Pennsylvania against this virus. But it's going to take time. It's going to take time to distribute and to administer these vaccines throughout all of our phases to protect people in Pennsylvania. So right now, more than ever, in these winter months, we need people to show personal and collective responsibility. We live in a country and in a state which is blessed with tremendous freedoms. But since the beginning of the Republic and the beginning of our state, that freedom is associated with responsibility, a personal and a collective responsibility to help each other and to work towards the common good. So I am asking everybody to work with us, to stop the spread of this dangerous virus in Pennsylvania. And, with this great day of starting to distribute the vaccines, if we all work together, we will be successful.
Thank you so much, Secretary. That concludes today's press briefing. A recording of this will be available through PAcast and has been streamed on Facebook Live. Reporters who have any follow-ups can contact the Department of Health Press Office. Thank you so much.